This presentation is only going to be 5 minutes long, yet that's all it takes. 5 minutes without oxygen is all it takes for the brain to die. We have seen on TV or in real life people doing CPR. This measure is taken to try to better the chances of someone surviving if they have a heart or any other related issue. But do you actually know the specific steps of CPR? Imagine one of your friends tonight becoming unresponsive at a party or in the dorms. They could be one of the 1,500 alcohol and drug-related deaths on college campuses every year. What would you do? Would you know what to do? Would your friends know what to do? It's important for college kids to know CPR in order to help protect them and the people they care about. 98% of people who suffer heart-related or drug or alcohol-related instances and need CPR die because there's nobody there to help them before they get to the hospital. CPR can double or triple a person's chances of survival. IU and local organizations offer classes to teach people CPR. Learning is easy and a skill that can help save lives. CPR has some fairly basic but vital steps that help save lives. First, if you see someone become unresponsive, dial 911. If an AED is available, have someone go get that as well. You need to check the responsiveness by tapping them and asking them if they are okay. If they are unresponsive and do not have a pulse and are not breathing, CPR is needed. There are two parts to CPR. There is the compressions and the breaths. The compressions happen by putting your hands on the middle of the victim's chest and doing 30 compressions at 2 inches deep at a rate of 3 compressions every 2 seconds. Once the 30 compressions are done, you will move on to the breaths. The breaths are done by gently tilting the head slightly back, opening the jaw, breathing into their mouths to where you see chest rise, and that will be performed twice. At the end of that, you will go back to doing 30 compressions. This is done a total of 5 times until an AED is available. If an AED is not available, this cycle needs to be repeated until either another bystander comes to help, a trained professional arrives on scene, or you are physically unable to do it. Now, though we have discussed the guidelines of CPR, it is vital that if wanting to perform CPR that you are trained and have taken classes in CPR. Doing CPR is never a guarantee that you will save a life. However, doing nothing is a guarantee that they might lose their life.